Rorschach Test by Alan K. Hess. Mental Measurements Yearbook with Tests in Print. The history of the Rorschach Test, some highlights of it. The Rorschach hand drew all of his ink blots. He had originally developed the test to be used for schizophrenia. In 1939, it was used for personality testing. Rorschach was skeptical of it being used for this purpose. The purpose of Rorschach Test is it is a psychological test used to examine personality characteristics and emotional functioning, and it has also been noted to work with behavioral problems. Reliability and validity. Reliability of this test is it has open-ended responses that make it subjectively scored. The comprehensive system was put in place to basically help with that. The system looks at different trained scorers, and their score protocols were consistently the same between 88 and 99%. The validity of this test comes back again to the comprehensive system that was set up to help with it, but the fact remains that the clinical interpretation and write-up is partly subjective. Some of the strengths of this test is that the test has been around since 1921 and it's still used today. It has been used in court to help with court cases. The test is appropriate for clients from the age of 5 to adulthood, making it available to a variety of ages. It's a cost-effective test. It gives the ability to collect a lot of data because the answers are not fixed, and the clients are allowed to express what they are feeling and thinking in a non-constrictive way, so it gives the therapist a lot of information to work with. Some limitations to this test are the open-ended responses. The client can fake responses, and responses may be influenced by the therapist because of their attitudes or how they respond to the client. Test scoring is highly subjective. It requires highly qualified and trained personnel to administer the test, and this test has been noted to take hours to administer, like around 3 hours per test. Some cultural considerations of this test. There are some cultural differences to take into consideration when administering the test. Different cultures will respond with different common responses, and different languages can name the same object with words that are different. The client and the therapist must speak the same language or have an interpreter, and sometimes things can get lost in translation. It would be hard for the therapist to interpret the person's body language, not knowing their language, and and their language can be misconstrued compared to ours. Here are the ink blots. This is the first of 10, second of 10, third of 10. There are general different meanings for each one, such as this one. I believe it was considered to be a bat, was a common response for that one. And it's also, the test will look at how people interpret the colors, as well as the shapes, as well as the picture as a whole, or the details of the picture can be interpreted by the therapist giving the test. This one's my favorite. It's mostly colorful. And then here are the references for the information given. And that's all I have.